Hello there guys, welcome back to Big Pharma. Okay, last episode we were in the red and we still technically are. It just needs some, when you load up, it just need a little bit of time just to update. But we shouldn't be in the red for very long. So we are now in the green, or at least close to the green. There we go. And we have just got a new ingredient, which is what we definitely need. So what I'm going to have to do with that is I'm going to go ahead and get that in there, and we're going to go ahead and test it and see where the max strength is. Okay, so what we got here, alleviates erectile dysfunction. Well, we can't do it. Actually, we could do those because we have got the catalyst for that, but it's going to require mixing, and we haven't got no mixing. I really need those upgrade points so as I can actually afford stuff. So those things are actually cheaper, so I'm definitely going to just focus on that for the time being. We do need to focus, though, on getting more explorers to explore these. Now, we still need soothes cough, soothes rash, and painkiller. So for those we need lungs, pain, and skin. So there's lungs, that needs 4. Pain needs 5, and skin it needs 5. So I think we're going to go with lungs first. Okay, so let's go with that. Costs quite a bit to hire as well. So that's just unfortunate, that's just the way it is. At least we've got 3 scientists again now. Yeah, it must have been just a graphical bug. You know, these things happen. It is beta, guys, so, you know, that's to be expected. I'm actually really surprised, though. I haven't really come across many bugs at all. The only thing I've really come across when I had a play of it yesterday was there was one typo in the tutorial. And I think that was it. I can't even remember what the typo was. So, yeah. Fantastic. I know it was something really saft. I think it was supposed to be or, but instead it was is. I don't know. I can't quite remember off the top of my head. Oh yeah, and that's a bit buggy as well. The numbers popping up on the other screens, but I think Tim's already aware though anyway, so that's fine. Right, let's stop that. Fantastic. So we are looking at literally one agglomerator, and that's it. So we could just use this space here. Oh, should we do that? Yeah, I think we should. It's not going to take very long. All we need is an agglomerator. So if we stick an agglomerator there... Oh, we can't stick it there because it doesn't allow that. If I stick it there instead and then swing that round... That's going to... Yeah, it would help if you actually put the ingredient in. That would help, Feng. Aye. Oh, we got 7 upgrade points. Okay, now we've got 7 apparently. Let's go ahead and actually increase this then. There we go, since we are going to be using this. Okay, so that's fine, and now that can just straight into a pill. That's probably going to be an extremely cheap one as well, so that's good. Since there wasn't really that much of a process except for obviously the agglomerator, which we'll probably knock down again with the upgrade points soon. Let me see the upgrade points actually. So we've got 1 upgrade point. Well, that's not going to get us anywhere soon, is it? I'm going to go ahead and increase the pill maker bonus. Actually, that should increase our profit by about 9 or 12, something like that. Should be in the word. There we go. Might even be, oh okay, it's even more than that. But now we've got the antihistamine being sold as well, so we're gonna be in the green again. Fantastic. Okay, so that's a good sign. We've now got our second one being done. We're not gonna make master. We need 10 months for that, and that's not gonna happen. We might not even make Sodin expert at this rate, because we still need another. Just need to get the other 3 ingredients. And when we get to these ones that take 4 and 5, they take fucking forever to do. Let me just double speed that 2 seconds. Well, we'll keep it double speed anyway. 182 profit. That's not too bad. Let's take a look at our loan. Okay, we might be able to repay it soon. Fantastic. That's usually a good sign when you can actually repay your loans. Alright, let me go ahead and grab this one. Okay, so maybe we should think about getting the upgrade for this. I mean, what was the upgrade for this? It's very easy to get to. It alleviates insomnia. Which is that going to give us? Wow, there's actually a decent demand for it. It might be worthwhile considering doing that. That combat liver disease is still really high. I just debated, do I really want to go for the trouble of getting a mixer? I probably will need to buy a shaker. I will probably need to research shaker as well. Do I want to? Screw it, let's go for it. You know what, actually, even better. Let's get both at the same time. Should we go through it? I think we should go through it. Let me have a look and see what we need for it. So we need this catalyst here. The green. Oh, we don't have it. We don't even have the oh god, we don't. Oh, we're gonna have the catalyst, but we don't have it yet. But it's this one, isn't it? The goat. So I'm hoping that the catalyst lands in this slot. If it doesn't, then I will be a wee bit pissed off. And we are probably gonna end up needing a shaker. A shake. Yep. Alright, so where are we going on with this? So these are fine. I'm going to have a quick look and see how we're going on. Okay, so that's good. Nothing's below B, which is fantastic. Especially for the ones that got creams. That's fantastic. This one, this one's still been. This one will probably get even higher. So that's fine. Surprised how much money that particular one's making, actually. That one's making quite a bit. The female concept. I thought that would make quite a bit, and it is. That's fantastic. That drug is actually keeping us afloat at the moment. Just that drug alone is giving us that amount of profit. Oh, also we might be able to repay our loan soon, so that's even better. Come on, we need this soon. 60, 76. These are going there, so that's fine. I'll upgrade the creamer a bit to see if we can try and get our queues a little bit better. But we should have enough space here to do some mixing if we need to, and maybe some shaking if we really need to. Might even go ahead and buy this middle section. Fuck it, I'll just buy the entire bit since we've got enough money. I could actually research the planning permission for that, but I don't think it's worth it at the moment anyway. Maybe if we was to expand into these, then yes, it probably would be worth it, but I'm not really too worried about that at all. I just can't believe it. We're definitely not going to do the master. No chance in hell we're going to do the master. Okay, we've got the multi-mix. That's fine. Let's go ahead and put little grey points in that. Shaker's next. Brilliant. And we've now got the shaker. Alright. So basically it revolves around what this ingredient is and where the position of the catalyst is. And for the other ones that we need, so the pain and the skin, we are going to need an extra explorer. So I'm going to go ahead and hire an extra one anyway. Okay, go straight to Sting Weevil. Get the skin one. That's also the same catalyst. Okay, that's doable. We need one shake for that. Oh wow, I can see something really good here. If I shake that once, make this the base, we'll have two positives. I don't know if it's gonna be. It probably is worthwhile doing that, isn't it? Shall we? Shall we do it? I think we should. I'm going to. Sod it. But we do obviously need to do the other normal one as well. So maybe what we should do is just make sure that we sort this one out first. So we do need to serve the cough anyway first. So let's just import this. Let me get a belt. And my lovely analyzer. Let's analyze that and see what we can get with that. Love this game. It's actually kind of relaxing as well. It really is. It's not very often I enjoy strategy games that much. Alright. let's have a crack at this. Acid reflux, okay, whatever. Come on, get to it. I think it'll definitely be a good idea with the shaker to shake the that positive one down. It needs to be down anyway. It needs to be that positive one anyway, so it doesn't really matter. Okay. That's 25% done already, so that's good. We've got we've got 5 upgrade points, so let's go ahead and upgrade those to 2 apiece. That's good. Okie, so we got that one as well. It's looking a lot better. We're in a lot stronger position. We're definitely not going to make master. 2 years for expert. We might make experts. That's a push and go though, ladies. Okay, now we've got the one that we wanted. Sue's cough. Alright. Thank you very much. You have done your job. Okay, so Sue's cough is right there, and it's right in that one. It falls straight in there. God damn it. Alright, so we're going to need an agglomerator. We might need 2 agglomerators. What I'm going to do is I'm going to go ahead and stick that there, like so. That's 1 agglomerator there. Oh, I need to finger. Ooh, can I use these? Yes. Fine, I'll get to use these. Fantastic. Alright. I can't stick it there though, can I? No, that would be so inconvenient sticking it there, wouldn't it? God damn it. Also, I noticed it's very easy to like sell them when you're dragging with the mouse. When you're trying to move them, you can move with WASD as well. You know, that's not, you can do that, but I don't know. I've just got used to doing it with the mouse now. So yeah. Oh, we can do that. Oh wow, no, that's a nice fit. I'm pleased with that. So that should make quite a decent medicine. I don't know if it's going to give me that much profit though, because it has gone through quite a few machines to get to that point. So it's not going to make an awful... Oh, okay, 50 profit. That's actually not too bad. I was actually expecting less. So yeah, I'm actually kind of happy about that. Okay, then, so shall we get cracking to the next one then? So what's this cure that we need? What was it now? We was going to do the... that was it, the combats liver disease. It's still going for a lot of money. Can we pay back our loan? Yes, we can. In spades and buckets. Bloody hell. Okay. Let's go ahead and bring our 2 ingredients together. So we are going to need this one. No, not that one. This one. So we need the prevent grow. And this one. The one with the catalyst in. Okie dokie. So the first thing we need to do is shape this so that the grout is on the 3rd slot. Am I right? I am right indeed. So, let's shaky. Over here, yeah, let's stick it there. So that'll shape that once, like so. Yep, that's fine. And then what we'll do with that is we'll take the auxiliary, we'll take the multi-mixer, and we'll mix both of those together, like so. And then we might need to change the base yet. I don't know what. The base, I want the bottom of the base, don't I? So, yeah. There we go. Fantastic. So, if we look at that now, that is now kind of ready to be done. We do need to increase the concentration of first. So, let's go ahead and do that. So, if we get the agglomerator. Agglomerator. I'll keep... What the fuck? I've been calling it agglomerator for the past... What, 6 episodes, and I can't pronounce it at all now. Right, so we're getting there. We are getting there. Don't worry, guys. We'll get there eventually. So we'll put that there. We'll plot that there. That's going to give us the what we need. And now we need a dissolver. To be in awkward position in there. Right, let's stick it there. So dissolver there. That will give us good stuffs, I hope. Oh, I'm gonna miss it. God damn it. Now hang on. That upgrades to I can upgrade that to an easy asthma. Oh yeah, oh yeah, oh yeah. Okay. We got this. We know what we're doing now, guys. Yeah, clearly because I've just put that in the wrong place. But yeah, we definitely know what we're doing now, don't we? Yeah, of course we do. Right. So that goes into the agglomerator. Yeah, that goes up there. Yeah. Now, if we use the agglomerator again, it's going to increase that. Right, okay, yeah, we got it. We've got this. We know what we're doing now. This is going to cost a lot, by the way. Ingredients. Okay, we've now got Sue's Rash. I'll cover that in a bit, but we need our explorers to get the pain one now as well. We will do that in a bit. Let me concentrate on this one first. So there we go. We've now got... Oh, it's all the way at the bottom. God's sake. Now, hang on, because we can upgrade this even more. Holy crap, we can upgrade this even more. But we need to get the icon... Right, what I need to do now is get my analyzer and analyze where this is. Now, I'm kind of... This is going to be a little bit of trial error. So what I'm praying for at this point is for this effect to be active over here. It might not. The fact that you need so much of a high concentration to do it leads me to believe that it might. And if it does, we can make a dual cure drug, and that's going to sell for tons, absolutely tons. But we need to get the right fingers first, so we need to go through the analyzer. The only other problem as well is it's going to be done every other day, since it's going to be a process cost of 2. We can't do nothing about that, unfortunately, unless we make 2 lots of mixers. And I think we'd need 2 lots of shakers, wouldn't we? I think we would. Yeah, we'd need 2 lots of shakers as well. I mean, we probably could do that. I've already made it now, haven't I? Shit. It'll be a bit too... I'm just gonna do what we're doing anyway. It's all right. It's fine. We'll be fine. Bronchitis, Soother, not bothered about that. Insomnia. So while that's doing that, let's have a quick look at our other ingredients. The one that we unlocked. So we unlocked this bad boy here, the Soothes Rash. So we need to get this anyway. So I'm gonna have to analyze that one. And then where's the slot free? Oh, there's no more slot. There's no more free slots. Oh dear. That means I might. You know what I'm gonna have to do? Might be worthwhile getting planning permission, especially since I've now got 19 upgrade points that I've completely forgot about. Good lord, that is silly thing. That is really silly. All right, let's concentrate on this. Let me get agglomerator, evaporator, dissolver. There we go. I'm okay with that. That's fine. Okay, so we got the one that we wanted, is the combat liver disease, so I don't actually want to get the other one, although it's just found the other one out, so that's fine. Okay, so we now know that that's where it is, so we could actually, in theory, get that up and thingy. I mean, I'm going to try anyway. It's worth trying, isn't it, guys? It's definitely worth the try. So I'm going to stick that there. We'll feed a belt round there. We'll try and use this section of the floor. Okay, so that's going to increase it to 15. So we need one more to increase to 17. Yeah, let's try and use this bit again. Yeah. Then we'll come back round and do it like that. Okay, so there we go. Now what we need for that is we need a dissolver. So I'm going to try it out first. If it doesn't work, no hard feelings. We can just carry on as normal. We don't have to worry about it. But if it does work, then I'm laughing. I'll be rich. Oh, yeah. It's actually worth more. It's actually worth bloody more than that, and that pisses me off. Okay. Now we know that that's the case. Let's move that over there. Oh, Feng, you shouldn't have done that, you donkey. Alright, so now we've got the agglomerator. Actually, we just need two more. Right, so all we actually need now is the 2 evaporators. So I'll concentrate on doing that next. So 1 evaporator there. 1 evaporator there. I think that's right, isn't it? Let's continue that. Yeah, this is going to be quite costly, but it should be worth it. It would have been even more worth it if that was if that would have moved down. That would have been absolutely fantastic. Yeah, that's fine. That's great. Do we need the cream? No, we can take it straight into a pill. So let's go ahead and make 2 pill printers, like so. Might want to increase the pill print upgrade so that we actually get more money from making pills. Okay, so that's great. That's absolutely fantastic. Now let me check my research. How's this going on? Alright. Mozzie new product, liver diseases. Let's check the damage. 290. Fantastic. And obviously that will get even more and more as we've got the... why is there only 0 livers healed when it's already at the max potency? Maybe it doesn't always, you know. Maybe that's not the case. Oh well, it doesn't really matter. As long as we're selling them, that's fine by me. Alright, how are we getting on with our other ingredient? We should be quite close now. Yeah, 75, and I think that'll be the last ingredient we need. So now we need to focus on Sue's rashes. Plot purchase. Now that's perfect. That's exactly what we needed. So I'm going to go ahead and upgrade that. I'm going to upgrade it one more time, and then we're going to purchase more land. So we need to wait for this to go up a little bit. Shouldn't take too long. As you can see, per day it's going up pretty high, so that's good. Come on, get it up to 2. Get it up to 2. There we go. Yes. Alright, so let's concentrate on buying this one over here and this one over here. Okay, so let's get it a quick. Actually, no, we can carry that on, can't we? Yeah, we're not even gonna make the blue one at this point. Okay, so we're gonna make Sue's rash, so we need to import that. We are making enough money now for me not to worry about the analyzer. I'm just gonna go ahead and just try and speed this up a little bit. So, what do we need for this? We need all we need really is 2 ionizers. So let's go ahead and do that. 1 ionizer there, 1 ionizer there. Plunk that there. Oh, my stomach's rumbling. I need something to eat. I'm going to have something to eat after this episode, I think, and have a break. Yeah, so actually, from episode 1 to 8, I think this one's 8, it's all been the same recording session. So, obviously, if you put comments down in the comment section, I haven't listened to them, that's the reason why. So, yeah. Okay, so that's good. That's fine. Did we just get rid of a? Wow, we got rid of 2. Wow, that's fantastic. That's actually really cool. All right, so let's get the creamer. Creamer can get straight there. That is really efficient. I don't think you can get much more efficient than that. Actually, that's efficient. It might not sell very good, but we're gonna do it anyway. So let's get that. Ingredients. Okie dokie. Let's check the ingredients. Okay, so that's our painkiller, which we are going to do now. Again, I'm not going to worry too much about the thingy of it. We're just going to worry about actually selling it. Where's it gone? There it is. So here's our painkiller. We need 1 agglomerator. And that's probably not the best place to have put it. I've just noticed that. That was a bit silly of me. In fact, hang on, let's just move that to here instead. Actually, that might not be a very good place either. Oh, well, it doesn't quite matter. I could have done the other way around, but it doesn't really matter. And I suppose what we'll do then is just use the evaporator, which I can actually just attach to there. Then I can just bring this down, like so. And make... I think I should make pills for that one, can't I? Yeah, I can make just a pill printer for that. So yeah, 1, 2 pill printers. I know I can just sit back and relax because everything should be running smoothly now. So that's fantastic. Let's name that. Oh god, we're getting 40 frames again. Yeah, the memory leak is a bit of an issue, to be quite honest. It does seem to be doing it now. Every hour rather than every 2 hours, which is a wee bit silly. But it's not game breaking, you know. I can always just take it off and put it back on. That's not really, you know, that much of a bother. Right, let's go ahead and upgrade these because we need to. There we go. And there's our reset. I bet we got 10. Yeah, I was going to say I bet we got about 10 upgrade points, but yeah, we got enough. So upgrading that is actually going to make it now more. Yeah, that's going to actually give us more profit now than the creamer. Actually surprised that the creamer actually gives so much added value of the combined strength. That's really weird. Because I mean, it's definitely something you probably want to get. You probably will want to get a creamer anyway, because sometimes you're not going to be able to get rid of the negative effects. And the fact that it automatically increased the combined value by $30. I mean, it's already $20, and it's only got one process time, so it probably takes up the same amount of space theoretically as pill printers. But I don't know. Seems weird to me. I don't know. I'll tell you what. You know, it might be better rather than just having the increased combined value by $30 right off the bat. Maybe the actual upgrades could increase both a little bit of side effects as well as a little bit of the combined value, but make the combined value right at the start smaller. So, for example, if you start off with 5% combined value, and then increase like that, but by the time you get to the last upgrade, it'll be 30 anyway. So I don't know, because creamers seem a little bit OP to me. It might just be me. But they seem a wee bit OP compared to pill printers. I suppose if you invested fully in pill printers, it'll, you know, might make more anyway. I mean, you'll make $5 more per pill, which I suppose is quite substantial, really, I guess. But I don't know. It just seems weird. Okay, so we are literally now just waiting for the sky to drop. So I'm going to pause this for a bit, and I'll come back when we get a bit closer to after we got to supply. We're definitely not going to make the 5 months at all. Definitely not. So yeah, I'll stick a pause in here, and we'll be back very shortly. Oh yeah, by the way, it turns out I'm a dumbass. I didn't even need a second pill printer here. I actually kind of forgot about that. Since this is only producing every other day anyway, I don't actually need the other pill printer. So, I'm dumb. And I know someone is probably going to mention that in the comments. Say, you only need the one for that because it's only doing it. I know. I've got it now. I've done it. Shut up. I've done it. Okay. Yeah. Alright, so I'm just looking at basically what I've made so far, and obviously, as I expected, the painkiller and the Sue's Ratch was actually kind of a guess, a good guess. So I'm actually really pleased with that one. That's actually gone to a B. But yeah, the painkiller wasn't great, so that's not really that's to be expected, I guess. The combat's liver disease, though, look at that! Wow, that's fantastic. $420 profit. And you know, that's the one we spent the most amount of time on trying to get the dual cure. And I suppose what I could do, obviously I'm not going to do it now because we're not exactly close yet. But I think what I might do next time, if I have a bit more time, is I'll actually look through the ingredients and see which one would be better to go with that. I mean, if we were to make, say, a dual cure for that one. Say for example, I mean, which one was it now? It was I'm trying to find out which one it was now. I mean, this one for example, I mean, what we could have done with this one, instead of using that one, we could have used this one. What I could have done is if I'd have where was it? Which one was it now? It was this one. So if I'd have shook this one up to make that one get down, made this one the base again. Actually, I wouldn't be able to make that one the base because this one would have had to be made the base. So I would have had to shook that one. I would have shut it twice and then bring it down. Yeah, I would have had to shut it twice, then bring it down, and then we would have got Sue's Rash and Prevents Growth. But then we'd have to think about. I mean, that one's lucky. That one could actually be upgraded straight away because it's already got the cataclysm built in. The catalyst built into it. Cataclysm. Feng. But yeah. So that's one thing. That's another thing that's one way we could have gone about it. We could have even just mixed it with yet another ingredient. Let's say, for example, maybe removes warts. If it had the same max strength as the one that the other one had, and then done it that way, and we might have made an even powerful one, which that might have been even better. It's all these things that you can do, and it really intrigues me, and that's the reason why I absolutely love this game. There's just so many combinations of stuff you can do, and you know, because everything being randomly generated, it's just a unique experience every single time. It's fantastic. So I'm gonna give this a bit longer since what I could do actually is I could make a second painkiller line actually. So let's go ahead and do that. We're going to oversaturate the market, but I don't care. We don't care. We just want to try and get this over and done with. So if I go ahead and stick that there, I'll make exactly the same pill. Actually, no, I won't make exactly the same pill. What I'm going to do this time is I'm actually going to go ahead and make another agglomerator. I wonder if I'm going to make another one of these, and then we're going to put it through a creamer. Find us down creamer. There it is. There we go. And that's going to give me a painkiller with a side effect, but it might also be a bit better. I haven't put it through a thingy, so I haven't put it through the thingy, guys. I haven't put it through the tester, the analyzer. So you know, that's just the way it is. I suppose I could put it through an analyzer, but it's pointless at the moment. Acne no more. There we go. Acne no more. It's supposed to be a painkiller. Yeah. Oh, ache no more. Duh. Oh, I read that completely wrong. Duh. Let's see how it goes. So, pain's eased, not a lot. At least it's not. Yeah, at least no one's nauseated by it, so that's good. It's not even doing. Oh, it's not even doing half. Jesus Christ, that's so terrible. But at least from providing double the amounts, that's going to be done a lot quicker. We're going to provide in 60, so that's going to take a lot less longer. Rashes, yeah, that's nearly done, so that's fine. In fact, actually, the rashes might need to go up as well now. Bollocks. Oh well, doesn't matter. I'll just put another pause in here, and we'll wait till we get to the last month. So yeah. Okay, so here we go with just this second completed. That's fantastic. Again, it was quite difficult. It was pretty time consuming as well, because obviously we had to, you know, try and get the ingredients, and we had to backtrack with the research and whatnot. But you know what? This has probably been the most fun level for me, the fun change for me, because obviously not only did we well, we nearly filled out 3 buildings, but not only did we do that, but we did have a little bit of a play around with trying to mix and make a dual cure. While it didn't work, it was still fun attempting it, and I'm really looking forward to see what the other challenges are after this. So then, guys, we're gonna leave the game now since we've done this. Fantastic. And I'm gonna end this recording session here. I'm absolutely starving and I'm actually quite dry. But we'll pick up from this on the next recording session. So I'll see you next time, guys.